Hi, my name is Megan McPhee, and I'm a PhD student at the Centre for Neuroplasticity and Pain at Aalborg University in Denmark. So recently, my supervisor, Professor Thomas Graven Nielsen, and I published this paper in Pain, which looks at pro and anti-nociceptive mechanisms in recurrent low back pain patients between painful periods and pain-free periods compared to healthy individuals. Now you might ask, why did we want to do this study? I mean, there's already a lot of cross-sectional research out there telling us that people with painful conditions differ from healthy controls and that they usually have a more pro-nociceptive profile. But that's just the problem. This cross-sectional research doesn't give us an indication of the temporal relationship between alterations in pro and anti-nociceptive mechanisms and the development of the painful condition. There is some evidence to suggest that alterations in these mechanisms could predispose one to pain, or there is also evidence on the contrary that it may just be because of pain and ongoing nociception that these alterations in pro and anti-nociceptive mechanisms occur. So what we wanted to do was take the same patients and look at them when they were in pain versus not in pain, because then we could tease out what was related to just the presence of pain and potentially nociception itself, and what continued to be impaired when they weren't in pain. So we recruited 30 recurrent low back pain patients who had a current episode of pain. That means pain that had lasted for more than 24 hours and was similar to an episode that they'd had in the past. We then recruited 30 healthy controls and individually matched them on age and gender to the recurrent low back pain patients. In each of the sessions, participants went through a patient history and physical exam, then filled in a number of questionnaires, both to characterize demographic details, but also things like their sleep time, mood, catastrophizing, and physical activity. The patients also filled in questionnaires related to their disability and to rate their pain intensity and unpleasantness. We then performed pressure pain thresholds with a handheld ergometer, both over sites locally at the lumbar spine, but also at distant sites at the elbow, the shoulder, and the calf. We then used a cuff ergometry system on the lower legs to assess deep tissue pressure pain sensitivity, and then used this system to measure temporal summation of pain, where we apply a repeated painful stimulus and look at the increase in perceptual pain over the series, and conditioned pain modulation, where we apply a test stimulus, in this case a ramped inflation, to detect pain detection threshold and pain tolerance on one leg, and then we apply that at the same time as a conditioning stimulus, in this case a tonic cuff inflation, on the opposite leg. Now for what we found. Well, I think that's really interesting because basically with our patients, we found that when they were in pain, they showed widespread hyperalgesia to pressure and facilitated temporal summation. But this was both in comparison to the healthy controls, but also to themselves when they were pain-free. So it seems like the facilitated temporal summation and the pressure hyperalgesia were just related to the presence of pain and nociception itself, and not necessarily something that was a trait in these individuals. For conditioned pain modulation, however, it was a little bit different. We just found an overall group difference. So it seemed like CPM was impaired in the recurrent low back pain patients compared to controls, but this didn't normalize at the second session. So of course this is just the beginning, and we need more studies to really tease out this relationship between pro and anti-nociceptive mechanisms and low back pain development. But if you would like to read more about this particular study, then please check it out on Pain's website. Thanks a lot for listening.